Okay, welcome to the first Get Active educational video presentation. This is on the knee. I'm going to get straight into it today. Obviously, with your assessment, you do a full assessment and note down everything that they say in the current history. We're going to pull out all the major points that I need you to cover. The first thing you need to do is establish the kind of disorder of the area involved. Obviously, it's the knee, but there are different types of things that they'll be complaining about. The first thing, which is the major one, is pain or dysfunction. So if they're complaining of pain in the anterior knee, so the front knee, that's very generalised. You're going to try and look at the size of the area and whether it's very local pain or diffuse, which is quite broad. What will give you an idea if it's anterior, meaning in the front, you're thinking about patellofemoral tracking, is usually the main problem, where they complain of pain right on top of the kneecap. Or underneath in the cartilage surface of the kneecap, as well as it could be, if it's just general pain, it may not be injury to the structures, it may just be stress through the structures from the biomechanical problems. So anterior knee pain, usually patellofemoral. If the pain is either on the medial side or the lateral side of the actual tibiofemoral joint, so not the patellofemoral, tibiofemoral joint, you're thinking collateral ligaments on the medial MCL, LCL on the outside. You're also thinking the ITB on the outside as well, where it comes in and blends into the right side of the knee. Underneath that ITB is also that bursa, which you've got to remember about, which can be very point tendinous and localised swelling through there. Other types of pain, if it's on the medial side, if it's like on a joint line area, you could be thinking meniscal tears left and right. And again, that biomechanical stress loading, if the biomechanics of the Q angle is wrong, you can have just pain through that side knee but no actual structures that are damaged. The other type of knee pain you can also get is referred pain down through the knee, and you can have that referred up and down from the medial tibial fracture, as in a plateau fracture. You've also got hamstring insertions coming in on the inside, as well as the bicep one coming down the outside as well. So don't forget about the hamstring tendons. If you're looking at if you look on this one, on the superior tibiofemoral joint, okay, so remember there's patellofemoral knee joint and the superior tibiofibular joint, you could be thinking actual ligament problems through the joint. Also, there's that common peroneal nerve that wraps around in front of the fibula, which can have neural irritation or tension problems in the lower limb. If you come back onto if you're thinking on the medial tibiofemoral on each side of the joint and the lateral side, if they're complaining of pain that's inside the knee, you're just thinking of structures that are more internal, like cruciate ligaments, the meniscal left and right, but also the chondral surfaces on both sides. More likely the chondral surface on the medial side, because that's the weight-bearing side, but also the lateral side. And you're also thinking of synovitis, which you'll see go further, it's in the swelling section. Anterior but inferior, you're thinking down at the tibial tuberosity. If there's pain over tibial tuberosity, that's where they're complaining of. You could be thinking Osgood-Schlatter's disease if they're a young person. Also the patellar tendon, where it hooks into the tibial tuberosity, or the guts of the patellar tendon. You're also thinking the inferior pole of the patella, like jumper's knee, that sort of thing.